Canine tooth resorption occurs in probably about 5 to 10% of the dogs that we see on an everyday basis. For some reason, the tooth starts to resorb. In veterinary dentistry, we really don't know what causes it, but we do know how to treat it. And the treatment, because it's progressive, is to extract the tooth.
So he had her on a lead, and apparently she saw something and gave my husband a terrible pull on the regular collar. And now that is, you know, connected to the mouth somehow. Because the next day she was with me, and some gesture that had to do with her neck or somewhere around the neck, she screamed. That day, as the day went by, she had her head down and she was shaking. And then she went ahead and did something or other and screamed again. Apparently something was hurting her. So I took her to Dr. Fawcett, who's my veterinarian. Apparently I thought perhaps she was hurt because of that pull, her back, her neck. And Dr. Fawcett examined her the whole day, took x-rays, and told me, look, this is wrong. There's something wrong with her teeth. Now, Nike always had bad breath. No matter what I did, she had bad breath, very bad breath. So anyway, Dr. Fawcett recommended Dr. Bellows, and the rest is history. It was a miraculous recovery. I left here approximately at 8:30 at night, and I got to where I live around 9:10, 9:15. Now, she had a bit of a problem getting out of the car. I had to help her because of the morphine injection she had just received. However, she was able to walk. I took her into her bed, and I expected moaning of some sort. I went, during the night, I went in to see her several times. She was asleep. But surprisingly, the next morning, when I went to the kitchen, which is the area where they're at, she was standing up in the middle of the kitchen, almost no swelling whatsoever. I looked at her and I was amazed. She went out on her own, went to the bathroom, I went with her, came back in. But my greatest surprise was when she saw me serving a bowl of food to my other Doberman, she went nuts and she ate. She never stopped eating. She never complained one solitary time. She bled a couple of little drops, you know, little drops, but that was it. And the rest is, as I told Dr. Fawcett, a miraculous recovery. This Dr. Bellows' hands are what we call silk hands.
Feel your dog may have tooth resorption, it'd be time to go to see a veterinary dentist. To find a veterinary dentist in your area, look up avdc.org, American Veterinary Dental College.org.